Spinal cord tumors. Definition. A spinal tumor is an abnormal mass of tissue within or surrounding the spinal cord and/or spinal column. These cells grow and multiply uncontrollably, seemingly unchecked by the mechanisms that control normal cells. Spinal tumors can be benign, non-cancerous, or malignant, cancerous. Primary tumors originate in the spine or spinal cord, and metastatic or secondary tumors result from cancer spreading from another site to the spine. Types of spinal tumors. There are two general types of spinal tumors that can cause pain: primary tumors and secondary, metastatic, tumors. Primary spinal tumors originate in the spinal column, such as by growing in the bones, discs, nerves, or other elements within the spine. Primary spinal tumors are usually non-cancerous, benign, and occur in younger people. Hemangiomas are among the most common benign primary spinal tumors. Osteosarcomas and multiple myeloma are two of the more common primary spinal tumors that are cancerous, malignant. Secondary spinal tumors, metastatic tumors, are tumors that have spread to the spine from a cancer that has started elsewhere in the body. These tumors are the most common type in the spine and are cancerous, have the potential to spread further and are typically fast-growing. Cancerous cells from the lung, breast, and prostate are most likely to spread and become lodged in the spine. Spinal tumors are referred to in two ways. Spinal tumors by the region of the spine. These basic areas are cervical, thoracic, lumbar and sacrum. The bony spinal column is the most common site for bone metastasis. Estimates indicate that at least 30% and as high as 70% of patients with cancer will experience spread of cancer to their spine. The most common primary spine tumor, originated in the bony spine, is vertebral hemangiomas. These are benign lesions and rarely cause symptoms such as pain. Common primary cancers that spread to the spine are lung, breast and prostate. Lung cancer is the most common cancer to metastasize to the bone in men, and breast cancer is the most common in women. Other cancers that spread to the spine include multiple myeloma, lymphoma, melanoma and sarcoma, as well as cancers of the gastrointestinal tract, kidney and thyroid. Spinal tumors by location within spinal cord. Spinal tumors can also be classified based on their location inside or outside the spinal cord. They are as follows. Extradural tumor, a spinal tumor that forms outside the spinal cord's outermost protective layer, dura, is known as an extradural tumor, epidural tumor. These tumors are commonly metastatic and have spread from cancer located in another part of the body. Intradural extramedullary tumor, an intradural extramedullary, inside the dura, tumor grows under the outermost layer, dura, that covers the spinal cord but outside of the spinal cord. Usually these tumors are benign and slow-growing. They can cause symptoms of pain and weakness. Common intradural extramedullary spinal tumors are meningiomas that occur in the membranes surrounding the spinal cord and are more common in women who are middle-aged or older. Nerve sheath tumors, schwannomas and neurofibromas, that arise from the nerve roots that come off the spinal cord. These tumors may be present for many years before causing neurological symptoms. Intramedullary tumor, an intramedullary tumor grows inside the spinal cord and typically arises from the cells that provide physical support and insulation for the nervous system, glial cells. These tumors occur most often in the cervical spine, neck. They tend to be benign, and surgery to remove the tumor may be difficult. The two most common types of intramedullary tumors are astrocytomas and ependymomas. Causes. The cause of most primary spinal tumors is unknown. Some of them may be attributed to exposure to cancer-causing agents. Spinal cord lymphomas, which are cancers that affect lymphocytes, a type of immune cell, are more common in people with compromised immune systems. There appears to be a higher incidence of spinal tumors in particular families, so there is most likely a genetic component. In a small number of cases, Primary tumors may result from presence of these two genetic diseases. Neurofibromatosis 2. In this hereditary, genetic disorder, benign tumors may develop in the arachnoid layer of the spinal cord or in the supporting glial cells. However, the more common tumors associated with this disorder affect the nerves related to hearing and can inevitably lead to loss of hearing in one or both ears. Von Hippel-Lindau disease. This rare, multi-system disorder is associated with benign blood vessel tumors, hemangioblastomas, in the brain, retina and spinal cord, and with other types of tumors in the kidneys or adrenal glands. Symptoms. Non-mechanical back pain, especially in the middle or lower back, is the most frequent symptom of both benign and malignant spinal tumors. This back pain is not specifically attributed to injury, stress or physical activity. Loss of sensation or muscle weakness in the legs, arms or chest. Stiff neck or back pain and or neurologic symptoms, such as tingling, increase with Valsalva maneuver. Difficulty walking, which may cause falls. Decreased sensitivity to pain, heat and cold. Loss of bowel or bladder function. Paralysis that may occur in varying degrees and in different parts of the body, depending on which nerves are compressed. Scoliosis or other spinal deformity resulting from a large and or destructive tumor. Diagnostic evaluation. Patient history. Taking the patient's history is an important first step. Some basic info is gathered, including current symptoms, pre-existing conditions, past illnesses, injuries, medications, diet and lifestyle, and family history. For patients with a current or previous history of cancer in another region of the body, it typically raises the risk of developing a spinal tumor. Depending on the stage or severity of the cancer, the treatments may vary. Physical exam. A doctor will palpate along the back or neck and observe for any lesion, bump, instability, or other abnormalities. Clinical tests may also be performed to test the arms and or legs for strength, sensation, reflexes. Any abnormal neurological functioning could indicate inflammation or compression of the spinal cord and or a spinal nerve, and may need further investigation. Medical imaging. When back pain is suspected to be caused by a spinal tumor, various medical imaging technologies may be considered. Computed tomography, CT, scan. CT scans are increasingly being used as first-line imaging for suspected spinal problems because, compared to X-rays, they give an enhanced view of the bones. A CT scan uses X-rays and a computer to create a series of cross-section images for greater detail. Magnetic resonance imaging, MRI, scan. MRI scans are the best at viewing soft tissues and can be particularly helpful in distinguishing tumors from other neurovascular structures. A gadolinium contrast-enhanced MRI scan can help identify whether a tumor is outside the spinal cord or inside the spinal cord. Positron emission tomography, PET, scan. PET scans can be useful in confirming whether an abnormality that has shown up on other imaging is a tumor. The patient is injected with a small amount of a radioactive tracer, typically a type of sugar, which flows through the bloodstream. A special camera is then used to identify areas of the body where the radioactive tracers have collected, which are more likely to be in tumor cells. Bone scan. This scan involves injection of a radioactive substance, tracer, that flows through the bloodstream and is absorbed by bones. Then a special camera is used to clearly see the bones and any areas of abnormal changes in them, called hot spots. Biopsy. When a spinal tumor is suspected based on imaging, a biopsy may be requested for verification and or to learn more about the tumor. Two general types of biopsies for spinal tumors include percutaneous needle biopsy. A needle is inserted through the skin and into the tumor using X-ray guidance. Percutaneous needle biopsy is the most common type when trying to diagnose a spinal tumor. Open biopsy. This biopsy is considered open surgery and usually occurs when another surgery is already planned. Open biopsy may be incisional, remove part of the tumor, or excisional, remove all of the tumor. Blood tests. Blood tests may also be part of the diagnostic process for spinal tumors to help screen for cancer. It is also possible for a blood test to help confirm where a metastatic. Management. Spinal tumor treatments vary based on the tumor's type and location, as well as other serious health conditions that may be present. Treatments for spinal tumors can range anywhere from just observation monitoring all the way up to complete surgical removal. Watching and waiting. Rarely, a spinal tumor may be discovered without having caused any symptoms yet. For an asymptomatic spinal tumor, it may be best to simply monitor it every few months with imaging to ensure that it is not growing rapidly. A benign spinal tumor may or may not develop into a problem later. As long as a benign spinal tumor causes no symptoms, no treatment is required. By regularly monitoring the tumor, treatment can begin shortly after symptoms start, which may result in a better outcome. Non-surgical treatments for spinal tumors. Non-surgical treatments may be used instead of or in conjunction with surgery for spinal tumors. External beam radiation therapy. External beam radiation therapy, EBRT, involves using a machine to send a beam of radiation into the body and target the tumor. The goal is to destroy the tumor cells and or shrink the tumor. Another form of radiation therapy, called stereotactic radiosurgery, involves sending multiple beams from multiple angles with the purpose of preserving as much healthy tissues as possible while targeting the tumor. Each individual beam of radiation is low power, but many such low power beams can meet at the tumor and intensify there. Radiation is commonly used after spinal tumor surgery as a way to destroy any remaining tumor cells. It may also be used in cases where the spinal tumor is considered inoperable, or as a way to shrink the tumor before surgery. Medications. Medications that may be considered as part of a treatment plan for spinal tumors may include: corticosteroids may be prescribed to help reduce inflammation and possibly the size of the tumor. Pain medications may help reduce pain from a spinal tumor. Examples include nerve pain medications, opioids, and NSAIDs, non-steroidal anti-inflammatory drugs. Chemotherapy drugs, which may be taken intravenously or orally, target cancer cells throughout the body. While chemotherapy has not been shown to specifically target spinal cord tumors, it may be considered as part of an overall treatment plan for cancer. Immunotherapy drugs, which aim to stimulate the immune system into attacking abnormal cells, are a newer treatment and still being studied. Some evidence suggests that immunotherapy is capable of shrinking spinal tumors, but more research is needed. Palliative care. When a spinal tumor develops as a result of advanced cancer, or alongside other serious health problems, the patient's overall health and life expectancy may need to be considered. If a patient's overall health suggests that surgery or other aggressive spinal tumor treatments will not be beneficial, palliative care may be chosen. Palliative care tends to focus on pain management with medications and keeping the patient as comfortable as possible. Surgery for spinal tumors. When surgery is performed on a spinal tumor, there are typically three goals: remove all of the tumor, or as much as possible; preserve neurological function; maintain spinal stability. Numerous surgical techniques are available, depending on the type of spinal tumor and its location. Some surgeries for spinal tumors can be done using minimally invasive methods, whereas others may require more extensive surgery or a combination of techniques. One of the most common surgeries for spinal cord tumors is the thoracic laminectomy. This procedure involves removing the back part of a thoracic vertebra, including both laminae and the spinous process. If any of the tumor remains after surgery, it may be treated with radiation or, less commonly, chemotherapy.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.